I would say one of the biggest challenges is making sure that the tool has all the pieces because historically, you'll have different tools for different pieces. There's a lot more programs that are involved on the medical side. So drugs under medical, like I mentioned, site of care. There's redirection and carve out, so different maybe entities that review, let's say, oncology or cell and gene therapy. And so there's a lot more pieces that have to be thought of versus on the pharmacy side, a drug is run through the pharmacy claim system, it rejects, it stops, and a case can get be initiated, right? And so and now there's a lot more portals, like I mentioned, doing this electronically. And so I think that that's probably the biggest hurdle is trying to find a tool that can integrate all these pieces um, throughout the plan, right? Because there's all different areas of the plan, as well as any other third-party systems that need to be integrated to be able to facilitate a medical review. There's still prior authorization, just like there is on the pharmacy side. On the pharmacy side, they might call it a quantity limit, but the on the medical side, they might call it waste management, or still, different kind of quantity programs that might just have different, vernacular for it, but essentially it's the same thing. It's a limitation on quantity. And then for step therapy, again, that's a very pharmacy-centric term, but they do have, you'll hear preferred alternatives instead of formula alternatives or step therapy, but essentially, again, the very same thing. And then the other programs that come into play, like I mentioned, are carve-outs, as well as site of care. On the medical side, they have red carding and gold carding. So sort of similar programs you can have on the pharmacy side where, there's a restricted network or you have to get your drugs at a mail order pharmacy versus a retail pharmacy, right? So there are different ways of restricting. It just looks a little bit different on the medical side and just different words. I wouldn't say it hinders it, but it does require knowledge, right? So whatever vendor that you're going to go with, you have to realize that, or that vendor has to realize that, yeah, there really are parallels within this, right? And I think that's what plans are realizing as well. So that's why things are becoming more integrated. Before it was like, oh no, we're so different. But really, if you lay it out there, and again, I have a slide for this. In the presentation is it really is very, very similar, right? It's not so different when you're talking about drugs. When you start talking about medical services and things like that, there might be additional layers, but when you're talking about drugs, it might just be called different things, but really it is very, very similar. The best practice would be first and foremost to make sure that your pharmacists are included in developing any criteria or utilizing, at the very least, reviewing the criteria, even if it's not that group that is doing the utilization management. I would say have a good tool that can be integrated, that already has the functionality. Really important to have the functionality both for the pharmacy and the medical side. Important to have a tool that will integrate with different APIs or vendors throughout to help all the different programs or connections and things like that. Also, lastly, have a good reporting space, right? Good reporting support to be able to follow through with internal audits as well as external audits.